Good afternoon. Good afternoon, everyone. Okay, I want to begin today with asking everyone to be um, alert to the heat and the humidity. The National Weather Service has issued an excessive heat warning for Houston and Harris County until 8 p.m., which means it's hot out there. That means the heat index will be between 113 to 117 degrees, and that will increase the chance of heat-related illness, and everyone should take precautions to avoid heat exhaustion. We're asking everyone to stay hydrated, drink more water than usual, use cooling towels, take cool baths or showers, wear light-colored or loose-fitting clothes. Young children, senior citizens, persons with existing health conditions, those are on certain medications are more susceptible to these heat-related incidents. So check on your family, friends, and neighbors, especially our seniors. Let me encourage our seniors, if you have air conditions and they work, please turn them on, and we'll figure out how to deal with the bill later. But please turn on your, don't be in a hot home. If your air conditions work, please turn them on, and that's important. With regards to the numbers for the day, the Houston Health Department today reports 158 new cases of COVID-19, bringing Houston's total to 63,834. Sadly, we are adding 8 new persons to the number of those who have died as a result of COVID-19, bringing the city's total number of COVID-19 deaths to 820. And again, you take note, we have the 8 newly reported deaths include 2 Hispanic men, ages 40 to 49. Both had underlying health conditions, but their deaths are a reminder that COVID-19 has taken a toll on people who are in the prime of their lives and affecting our most vulnerable populations. I do want to highlight again that the overall majority of people who are dying as a result of this disease happen to be Hispanic and African Americans. And so let me just pause to say to these, to everyone, but specifically to these communities, please get tested, okay? Please get tested. At any of Houston's free testing sites open to everyone, it is important for you to get tested and to know your status. It will protect your loved ones, your friends, your neighbors, as well as yourself. And so, and then let me encourage everyone in the city of Houston, please continue to put on your mask when you're around other people, when you're in gatherings of more than one, when you're out and about in public, please put on your mask. That is important. And as I drive around or ride around, however you want to refer to it, go about the city, still seeing people who simply, in the midst of others, who do not have on their masks. When people at events, on the patio of restaurants, please put on your mask. And remember, we don't want to do it, but you face a citation or fine that will cost you $250. So again, I want to encourage everyone, get tested. There's no reason for you not to get tested. If you don't want to do the nasal swab, you can do the oral mouth exam at Minute Maid parking lot on the east side. But there's no reason for you not to get tested. Please put on that mask, and you don't want to get hit with a $250 fine at this time. Let me, on a positive note, the hospitalizations have declined from a record high in July, and today, Houston's COVID-19 positivity rate is 7.8%, down from, at one point in time, it was as high as 23% or more, and then it has gone down from 15.6, and then a week ago, it was at 9.2. Today, it is at 7.8. It's moving in the right direction. This is the last day of August. The goal that I announced close to a month ago was for us to be at 5% or below by the end of August. We didn't quite make that, but we're at 7.8%, and so it is showing progress that we are moving in the right direction. I will add that the report The current 7-day average within our hospitals, the Texas Medical Center hospitals, that positivity rate is 5.6%. So with regards to the hospitals covering our region, our area, Texas Medical Center, the people that they are testing as they're coming in, their positivity rate is 5.6%, and so it has been going down. But the positivity rate within the general community is 7.8%. Now that is good news, but again, as we look at schools, people returning to schools and other events, the goal really is to get to that 5% and to get below the 5% and to stay there. So we're moving in the right direction, and I'm asking people, if you continue, if you'll put on the mask, if you engage in social distancing, if you will avoid large gatherings, then we can achieve that 5%, I believe, within the next week or so. So please. Now, Labor Day is approaching, and many people will take Friday through Monday to visit with family and friends or travel. But you cannot relax while you are taking these days. So you know what happened during Memorial Day and the 4th of July weekend? People came together, and then the virus took off, and then you saw the numbers go up. So as we approach Labor Day, let me encourage people to be mindful. The virus is still looking for you. And so if you come together, then you will give it a home. So please, even as we approach the Labor Day weekend, please be very careful. Now let me just pause for a moment and let me bring up Dr. Peirce.
Thank you, Mayor. And as the Mayor said, it's good news, but it's not the time to stop, right? So we need to keep going. The graph that you're looking at now shows, the purple line shows the positivity rate, and remember, we go back and we recalculate the entire line every week as we get more and more information. And so if you're comparing this with previous graphs, you may see some fluctuation, but that's because we're just striving for accuracy. But the bottom line is that things are moving in the right direction, but we're not quite where we want to be just yet. So 7.8% is quite a bit better from 9.8% that we had last week, but we still need to get down to like under 5%. And even once we get under 5%, that's still not a magic threshold. We need to continue to do everything we can, because the school season is about to start, and then shortly after that will be what I call the viral season. That's when the cold and flu come. And so we need to, best we can, position this community in advance of those two changes in our healthcare environment, with the kids going to school and with the viruses that are going to be coming along. So it's important that people continue to get tested. We saw a significant drop-off, and to that degree, folks who want to get tested but have been a little bit reluctant to because they thought it was going to take a lot of time. The good news, bad news is that if you were to go to one of our testing sites right now, there's almost no wait. So that's bad news for me, because it means that not a lot of people are getting tested and makes me a little bit concerned. It's good news for you, because you should be able to get on property and off property very, very quickly. And so listed here, and I'm not going to go through it all, we have this at our websites, but most of the places, most you can go and just show up and get tested, and others that you need to go ahead and pre-schedule and have an appointment. But either way, we have tremendous capacity to do tests over what the demand is right now. And so if you're considering getting tested, remember, when you get tested, you learn, and you now are empowered to protect your family. And so we would really strongly encourage folks to go ahead and do that. And we also have it in Spanish. And the other thing I want to point out is everything else in life hasn't stopped either. So we've got another crisis that has been ongoing that I just want to bring a little bit of attention back to, and that's the opioid crisis. So this is a problem that we've been seeing in the United States for the last couple of years, and here in Houston we've initiated what's called our Frontlines Project, which is a very long name wherein we at the Health Department have worked with our partners at the Sobering Center, Baylor College of Medicine, and UT San Antonio, as well as our partners with the Houston Police Department and the Houston Fire Department, and we've been able to train and equip the police officers and all firefighters with the drug known as Narcan. So should they come across someone who is a victim of a narcotic overdose, they can quickly give them the narcotic antidote and revive them. And not only that, but then when that patient is taken to the hospital, another team comes and follows up with them, working with our hospital partners, so that we can educate their friends and family members as to what happened. We give them some Narcan and educate them on how to use the Narcan before they leave the hospital. And so to give you an idea of the number of cases we've done, so in 2019, the Houston Fire Department alone used it 1,300 times, used Narcan, the medication, 1,300 times. And here in 2020, it's been over 1,000 times, and the year's far from over yet. And to remind people that during the period of the COVID crisis and the economic impact, that has added additional stress to individuals and to their families. And sometimes folks will turn to drugs and alcohol and opiates in particular. And so this is a problem which has continued to go on and actually gotten worse. And it's been a little bit lost in the noise of all the conversation about COVID. But it's very real, and I want folks in the community to know that we have not taken our foot off the gas pedal there. We are continuing to work with our partners at the hospitals, at the universities, and with the police department and fire department to do everything we can to save those precious lives and help get them back on track to recovery. Mayor.
Thanks, Dr. First. Want to reiterate, plenty of testing capacity. They are there, and they are waiting on you. So please don't have them waiting too long. Plenty of testing capacity in the city of Houston. Want to say, as I bring forward Fire Chief Pena, we continue to pray for Captain Searcy. Continue to pray for him, lift him up in your prayers. Chief Pena.
Thank you, Mayor. And I want to echo what the Mayor just mentioned. Please keep Captain Searcy in your thoughts and your prayers. Send him your positive energy. He's still in ICU. He is a tough individual, and he keeps fighting this thing. But please continue to keep him and his family in your prayers. I do have some positive news in regards to our quarantine numbers. We are at 66 today, 66 firefighters in quarantine. As I mentioned, Captain Searcy is in the hospital. We do have a second one that's been admitted to the hospital, but have not gotten report that he is in ICU, but he is in the hospital. We've had 252 firefighters that have been tested or come up positive for coronavirus. At the moment, 31 are still positive. The majority have since returned to work. In regards to our occupancy task force, our firefighters, our inspectors, and arson investigators are still responding to complaints. Over the last 24 hours, we had 50 complaints that we responded to. We had one referral to TABC. And again, I want to express my gratitude to the business community for assisting us in maintaining a safe environment for everybody. Again, encourage people to get tested. We just went here about 30 minutes ago. There is no line. It's absolutely free. For the Spanish-speaking public, les urgimos y les sugerimos que vayan y hagan sus pruebas del coronavirus. Es absolutamente gratuita. Hay varios lugares donde pueden acudir a hacerse las pruebas. Pueden encontrar toda la información que necesitan acerca de los sitios donde están haciendo las pruebas en HoustonEmergency.org o en Alert Houston. Ahí pueden acudir para ver en dónde se pueden hacer las pruebas. Es absolutamente gratuita y a medida en que se acerca el día del trabajo, les sugerimos que mantengan el uso de las mascarillas, que mantengan el higiene y que mantengan la distancia física para no tener más casos positivos en nuestra comunidad. Thank you, Mayor.
This week, I intend to get two tests. One will be the test for COVID-19, just another one, and then getting my flu shot. So let me encourage people. It's the last day of August, September 1. That's when the light goes off in my head. So I intend to get tested for COVID-19, and then also to get my flu shot. I called my daughter this morning, or she called me, and we were having a conversation. I told her to go get a flu shot. So I'm going to tell you what I told my daughter. Go and get your flu shot as well, okay? This is especially important when we're dealing with COVID-19. And then go to one of the testing sites and get tested. Starting tomorrow, Houstonians can donate to help our neighbors in East Texas and Louisiana recover from Hurricane Laura. The Mayor's Health Equity Response, the HERD Task Force, is working with Kroger, President Joe Kelly, Gallery Furniture, owner Jim McInville, and the Relief Gang, Trade the Truth, to coordinate Houston's paying it forward hurricane relief response to Hurricane Laura. All donated items will be sent to Port Arthur, Orange, and Beaumont. Texas, as well as to Sulphur and Lake Charles, Louisiana. The supplies will be distributed to residents trying to recover after their homes and personal belongings were damaged or destroyed by Hurricane Laura. And due to COVID-19, all items must be new, and we cannot accept used items. That's because of COVID-19. They must be new. We cannot accept used items. The relief effort will accept donations beginning Tuesday. That's tomorrow, September 1. That's a very important month. It's my birthday. People can drop off donations at the George R. Brown Convention Center and Gallery Furniture from 9 a.m. to 4 p.m. Kroger stores will also have collection boxes at each of its locations. So again, you can drop off as of tomorrow, starting tomorrow, at the George R. Brown Convention Center. We're asking for supplies, including diapers, cleaning supplies, especially with bleach, personal hygiene items, non-perishable food, bottled water, pet food, and supplies. So if you will do that, really appreciate that. You can also donate online by going to houstontx.gov/Laura-Fund. That's houstontx.gov/Laura-Fund. 3 years ago, Houston was hit hard by Harvey flooding, and people from across the country assisted us. And I mean, they sent the supplies by the truckloads, 18-wheelers rolled into the city of Houston. We now have an opportunity to pay it forward and help others, but for the grace of God, there go I. It could have been us. So do what you can to assist our neighbors to the east, and in addition to the supplies, pray for all of them as well.